Hey, everybody. Welcome back to another edition of AI Diatribe. My name is Jason Lowe. I am your host, and I am joined today by three individuals. We're going to have a larger session today with more participants. As always, joined by my co-host, Matt Konwiser of IBM. And today we're joined by Christie Mealo she works for 90 North, which I understand is a division of IPG Health, and she's the Senior Vice President of AI Products. And going off of what I read, she and her group develop AI first software solutions that push the boundaries of innovation in healthcare, as you would think would happen with AI. And we are also joined by Brian Green, who is the Chief Artificial Intelligence Officer and Strategist at Healthvision.ai, but also serves simultaneously as the CEO and Chief AI Officer at Envision Health. So welcome, Brian. Today we get to, as you can tell by the titles and the companies that these two work for, today we're going to dive into something that is actually extraordinarily interesting, AI in healthcare. So I'm going to go ahead and throw this out because I'm really interested to hear what your generalized answers are for this first question. And let's start out with you first, Christy. And then Brian, please follow up with an answer if you'd like. My question for you is this: why AI in healthcare?
Yeah. Healthcare and finance are both regulated spaces. Well, I guess the answer is twofold, right? For one, and maybe I'm copping out to the obvious a little bit, but for one, any processes that are not easily like automatable with like rules-based or traditional ML or traditional solutions can be improved improved with AI. So building into operational flows to sort of reduce cost um, is one thing. And then on the revenue side, obviously there's a big demand to be offering differentiated products that are leveraging AI and the solutions to drive revenue. There's a lot that can be done in the space. I mean, we've seen with radiology, with reading images, with pharmaceutical companies, with discovering drugs, with even I'm now in med sort of advertising and communications. There's a lot that can be done there to like dig deeper into audiences, market strategy, market research. So there's a lot of things that can be done to innovate in the space as well. I hope that's a good answer, but that's what folks are interested in right now.
So that's a fantastic answer. Brian, what can you add?
Well, I guess my initial answer to why AI in healthcare is why not. I think,
Mm.
if I step back and say, healthcare is what we call a wicked problem. And I don't even know who coined the term wicked problem. It's something I learned in
Probably
public
someone from
policy.
Boston, you know.
It could be. But,
Definitely.
as a sociologist, social scientist, and someone that's worked in public policy, it's something that, resonates. And essentially, wicked problems are ones that don't have the easiest solutions. They're contradictory solutions sometimes, and there's constantly changing environments, right? And that's healthcare. Healthcare as we know it is broken. It's been broken for a very long time. And AI has a lot of opportunity, potential to potentially fix some of the hardest problems in healthcare. On the other hand, it has the opportunity to make some of them worse, right? And so we're dealing with, in healthcare, we're dealing with competing values, we're dealing with competing interest, right? And a lot of competing pieces. AI can actually help us, I hope, transform something that is in need of transformation in very specific ways. So we're at a very early stage, AI in healthcare. Let's see, but there's also plenty of solutions that are happening now and that are show promise for healthcare in the future.
Wild. And by the way, wicked problem was coined in 1973
Okay,
in a paper called Dilemmas in a General Theory of Planning.
here we go. That's why I
And
guess
yes,
I
I
know
knew
it.
that off the top of my head. I didn't research it while you were talking. Not at all. I know everything. I am GPT. So we had talked about some of the things we wanted to talk about today, Christy and Brian, but I'm gonna pivot a little bit unexpectedly, which I'm sure you'll both love. And it's because the New York Times just published an article 4 hours ago. So this is super, super recent. And it said something really interesting. It said that the healthcare industry and related professions, including social assistants and other things, added almost 700,000 jobs last year. And without it, the economy would have lost 500,000 jobs. So healthcare as a space is almost single-handedly propping up the economy and the job market as we're seeing right now. And it cites very specifically the rebound after COVID and a number of other facts when you look at the steady growth of healthcare and the job market and the profession as a whole. Now, here's my question. Christie, you talked about healthcare or AI being used in healthcare for lots of different things, communications, marketing, radiology. Brian, you talked about it as well from a physician's assistant, patient support, and other things. My question is, everybody's concerned about AI taking jobs away, yet in the biggest AI boom we've ever seen last year, we've seen a growth bigger than every other market. So why do you think we're seeing such a massive explosion in healthcare hiring in spite of the AI explosion? And what are your perspectives on that from your two different angles?
I mean, I think the majority of this is a rebound from COVID and the fact that healthcare has been understaffed in many serious ways. Nursing is one, but the other challenge is you can't recruit nurses fast enough in some of the key areas that have nursing shortages, right? So it's interesting. I'd have to look at the numbers more directly to see like who are these 750,000 jobs and what sectors are they. Obviously you can't fill jobs that there aren't people for, so we still have shortages in rheumatology, we still have shortages in neurology. There's clear areas where there's shortages, and there's rural healthcare, there's shortages. So it'd be interesting to tease out the numbers of where this hiring's happening, but I'd say part of it's the rebound effect. In general though, I think that AI is poised to create some new jobs in most verticals and in healthcare in particular. Um, people in software development, whatever, that are used to QA, QA and code. We have the same thing in healthcare, right? As we utilize AI more, we need people that are focused on, what's traditionally been CQI or continuous quality improvement. PDSA cycles in healthcare have always been focused on data projects, and AI is going to kind of, I think, allow that framework of what we can do CQI around the types of healthcare issues and medical problems. It's going to help us iterate a little bit faster and have clearer improvement projects. So that's an area where I see, people think of that as an administrative job. I don't think so, because CQI really requires people with subject matter expertise in various medical, whether it's a doctor, whether it's a nurse, whether it's a med tech, whether it's data scientist, or whether it's social workers. They all are part of that CQI team. So that's just one example.
That's good insight. Christie?
I'm concerned overall about, I'll just say I'm concerned overall about the economy and about, I think AI is kind of being used a lot as the scapegoat for bigger problems that are currently happening. We have like an increasingly autocratic government sort of expanding at the same time that we have AI expanding. And I wrote up an article about this yesterday. Well, I published it yesterday. A lot of academics in the, economic world think the folks that won the 2024 Nobel Prize in economics actually wrote on this and the negative impact on innovation. So I think we should be concerned about that across the board. I think when it comes to healthcare, to Brian's point, there's major rebound since COVID. So that is one large factor. I do also think healthcare is a heavily regulated space. It's not necessarily impacted in the same way macroeconomically, I guess, or economically in general as other industries because of that regulation. Yeah. So I mean, we're seeing more jobs and a need to kind of fill the gaps from COVID. It's also a highly regulated space, which makes it more difficult to innovate within, and it's slower moving. So I'm not particularly surprised by that.
Well, and if we think about this, right, healthcare, AI is a really good fit for healthcare, at least in my mind, because of a few specific reasons, right? One of those is that pattern recognition, of course, is very, very prominent. So there are a lot of different areas in which pattern recognition can be used in healthcare to the benefit of patients. But then also you're talking about language heavy workflows. Medicine is all about language and utilizing language for communication effectively. And then I think no one would disagree when I say that healthcare as an industry deals with a plethora of completely fragmented systems. You have silos all over the place. And so utilizing AI as some sort of a medium to combine these different systems and make them work effectively is really, really an important thing. And I mean, there have even been a couple of really important things that have happened in the last few days. For those that are watching this, we're recording this on the morning of Friday, March 6th. And yesterday, March 5th, when a couple of articles were published, one by Christie, Amazon actually launched Amazon Connect Health, which was an agentic AI platform for patient verification and scheduling and a variety of other things. Ironically, at the very same time, CVS and Google announced that they're going to move forward with a platform called Health 100, which is going to be an AI-enabled consumer platform. I find it very interesting that even in light of the fact that innovation is hard to come by in the healthcare space, people are trying to find ways to use AI in healthcare in a way that is very beneficial for patients. And that is that communication, that language-driven communication medium, which, as we all would hope, would make those that could serve on the front lines maybe take a step back and do a little bit more effective work and be a little bit more strategic rather than tactical as it relates to this communication with patients. My question for the two of you, and Christy, I would ask you to start first. Where are small innovative companies in this? I mean, both of you are working for companies that are smaller than Amazon, smaller than CVS, and smaller than Google Cloud, and yet you're also trying to innovate and create some new solutions to solve some of these problems. How are you going to be able to compete in this space when the big behemoths are coming in and wading in pretty seriously in these areas?
Yeah, well, and I actually work at a 60,000 person company now that we're merging with Omnicom. It's 100,000. So we're actually, and I used to work at CVS, so we're actually bigger than CVS. That being said, I think the large companies have to be concerned about small companies right now because
Interesting. Please expand on
really,
that.
yeah, large companies have a lot of people overhead, and we are going to see the job market be impacted by AI. The way we're going to see it be impacted across the board and what's really going to shake things up is, what once took a 100-person company can now be done with like a 10-person company, maybe a 20-person company. We've seen that happen with Gamma. They're a 50-person company. They're now worth like $2 billion. They're basically taking on PowerPoint, which has been around for 40 years, and they're like a major unicorn in the space. 45% of production code is now written by AI. So that means like where you once needed maybe a team of 8 software engineers, theoretically you should only need a team of 2 or 3. A lot of people are excited this year. I'm excited this year and into 2027 about moving towards things like an agentic SDLC, which is coming out of a paper from Anthropic. They launched it. I don't know when exactly it was published. It was published in the beginning of this year. I would recommend reading it. We're moving towards an evolution of the software development lifecycle to one where agents are in the mix with humans. I don't think there are a lot of good enterprise solutions for that at this point, but people are trying to adopt that quickly and trying to get ahead of that. So again, where you once had maybe 8 people on a software team. Now you'll have 2 or 3 with an agent for QA, an agent that's writing up tickets, an agent that's helping write code, and everybody is committing to the code base together in collaboration across the humans and AI. So we're seeing that across the board. I think that honestly, smaller companies have the leverage. We've also seen this happening in healthcare space for a while with tools that are, I'd say, digital first or application first healthcare solutions that are really shaking up the space. Like you have Maven for maternity care, Hinge Health for joint care, you have Ashi for gastric care, and they're all taking these, nice user experience, digital first, app first platforms to address, I mean, hims and hers, all of these things to address, to compete in the space more effectively than the traditional incumbents have been doing so. CVS has partnered with a lot of people, a lot of those folks, even when I've been there, but I could go on for a while, clearly. So I guess
I
I'll
just
wrap up and just say, yeah, the
Yeah.
I have
small
to make
ones
a quick
need to look
joke
out
though.
for.
You said Hinge Health, and the first thing I thought of was a lot of people that I work with use a dating app called Hinge.
Yeah.
So I
And
was like,
yeah,
is Hinge Health like date a doctor, or is it like actually getting healthcare services? I don't know. We're
uh,
overlapping too many brands now in this world. We've got too much stuff. But anyway, that's
that's
just
so true.
it's just an anecdote.
Yeah, but gotta watch out for the small fish, I think. What do you think, Brian?
Well, I mean, I kind of agree. I think the trends we're seeing though, like so the big players that named interestingly, there's a lot of big tech that have tried to insert themselves into healthcare, right? And they fail every single time, right? Think of like I'm going to throw out Mark Cuban, but Amazon did this years ago. They're pivoting. They're doing something a little bit different than what they tried the last time they tried to enter into healthcare in a big way. Tech needs to realize that healthcare is its own thing. Healthcare is a specialty, and most healthcare institutions are not very open to outsiders, right? Even for small businesses that are innovators, most of the small businesses that are doing innovation right now are on the edges of healthcare and trying to make differences for the things that are some of the biggest, wicked problems again, but some of the biggest challenges, like, for instance, remote patient monitoring, right? Medical devices. There's things that have been, um, not the best monetary part of healthcare, as well as not the easiest to orchestrate within large healthcare systems. That's where smaller businesses have come in, made a difference, etc. Another good example, ambient listening is the kind of thing that most healthcare institutions, most hospitals, most doctor practices right now have embraced that uses AI, right? Ambient listening is like the kind of note-taking tool that
Right.
transcribes the doctor notes into a patient chart. The first company to do that really was Abridge, right? Abridge.com or whatever. That's a startup, right? They grew pretty quickly. They had some really strong partnerships. They partnered with Mayo Clinic, Cleveland Clinic, some of the big names out there to pilot this and make it successful. Now, there's some challenges that they've had, but what I'll say about them is they started, 3 years ago? I don't even remember, and I don't even know if they're on Series C now, but what they've gotten in terms of their investment, they certainly have grown a lot. But what happened? Last year, Epic, who, in the US, Epic controls the EHR market, the electronic health record market in this country. About 80% of all healthcare institutions use Epic exclusively, right? They are a monopoly and they control the majority of the market, at least in the US, for EHR. But what they did is they announced, in my view, as a very cynical ploy, in I think October of last year, the end of the year, 100 different AI tools that they rolled out within EHR. Well, that's absurd. No one's adopting 100 tools within an EHR in a given point in time. Maybe 10 will survive in the next year, right? But they did it because they're throwing jello at the wall to see what sticks and gathering the data. And they're getting all the data to see, like, okay, which one of these actually makes, should we invest in? Should we roll out larger scale? And that sort of thing. So I think, they've done it to try to kill competition. They've done it to try to shut out some of these small businesses that were already in this space. Have they been successful? I'm not sure. The doctors that hated Epic before still hate Epic, right? So
I can
we'll see.
Yeah,
Um,
if I can add to that, I'll just say I think everything that you're saying makes sense. I would say, like, to your point on and to what we were talking about with Google partnering with CVS and with Amazon. I mean, Amazon launched Amazon Pharmacy or whatever several years ago, and it was a big failure. I think big tech is at the same risk that big med is at with some of these as incumbents with some of these new players in the space that are going to come out with smaller teams, AI native, doing way more AR, like way more revenue per employee. They're going to be shaken up. But to your point, Brian, like, I think there's also a difference in the point on healthcare being its own space that people need to be aware of. If big tech or some of these things come in, like a partnership model, like what probably Google is doing with CVS, is going to be more successful than Amazon just
exactly.
trying to come in and take over the space. It's just
Exactly.
going to be. When it comes to the scribes, that's obviously been the big story, but, like, to me, and maybe I'm a little cynical, it seemed obvious to me that somebody that's already plugged into the space will eventually erase that first mover advantage.
Sure.
So I've been a little it's low hanging fruit, but it's very obvious and it's difficult to defend against systems like Epic that are already integrated and distributed across the healthcare space. Not that Epic is, I mean, Epic's great, but they are very much a healthcare thing, and they are sort of a monopoly, to your point. So they're not known for their innovation, I will say, but I'm sure that they can get a scribe tool out there pretty easily.
Well, it's really
Absolutely.
interesting
Yeah.
because in the injection of capital into the tech space, going along with what you were both saying, the AMA actually put out a report in February of 2025. So, I mean, it's been about a year, but at that particular time, and again, keep in mind, this was at that time, 54% of all digital health funding was being funneled towards AI-enabled digital health companies. So obviously, from an investment perspective and a VC and a capital perspective, there's definitely a lot of interest. I'm not sure that I see, you raise a really good point, Brian. Let's see how much, I like how you use Jello. I've always used spaghetti. Let's see how much we can throw on the wall and see how much of it sticks. But I'm not sure that that's a bad thing, because another thing that's really interesting is that AI is being used to make everyone's life easier. In theory, it's going to take a lot of that rote work that is so frustrating and less creative and less fulfilling and take care of that stuff. And in the healthcare industry, we all know that the healthcare industry has been strapped for help for a very long time. You're dealing with a lot of people that are just burning out. Okay, so Reuters reported that 55% of U.S. healthcare workers are planning to search for, interview for, or switch jobs by the end of this year. And 84% said they feel underappreciated. I think it's interesting to think about the effect that AI could have on people's job satisfaction in the healthcare space.
Yeah, no, I agree. And I think, the other thing we often focus on AI thinking of tools or products, and certainly the tech industry focuses on products rather than what's really happening in healthcare right now. And you'll see making perhaps some difference is really thinking about how AI can help within existing workflows and free up other people's time or add context, right? So both one of the challenges with healthcare as one of the things that AI can always add is additional context to enhance decision making, have triage happen faster, right? Those are all contextual, adding context into workflows and into things that are challenging. How to communicate better with patients. AI is really good at enhancing communication and actually mirroring human empathy. So can we use that in ways that actually ease the burden of overwhelmed clinicians in very specific use cases? Not that the AI is replacing that, but it's actually augmenting the ability to communicate better, more timely, that sort of thing. The erosion of trust in general in healthcare, AI could potentially help bring back trust in some key ways if it's implemented correctly and if it's done leading with empathy, leading with ethics, leading with governance first. I think we can have some solutions that actually help some of the bigger challenges within healthcare. The flip side is that some of the use cases of AI that have been used, physicians or people that have been part of these research settings have said, it doesn't increase our cognitive load or cognitive burden, right? To have to now look at additional information or something that comes from an AI and approve it or not approve it, right? The human in the loop part of it. And right now, some of the AI tools have resulted in what physicians would say is increased cognitive burden, cognitive load, which is a challenge. You don't want that. You actually want less cognitive load, but it's early days, right? And so I don't know that what we see within a research context that are some of those types of challenges are necessarily where we'll end up. The fact that we're seeing them now in the data suggests that they're things that we can still try to improve upon. Because Jason mentioned burnout, right? And so that's the overlap is burnout and the kind of cognitive load plus the, are we increasing or decreasing manual work as AI is used to kind of bridge this gap? And that's the unanswered question. But I think, in general, we know that AI can be used to help those things and just continue to research and figure out the best way.
Looks like Christie's itching to retort, so I'll let you throw something in and then I'll come back.
It's just a minor thing, and I don't know if anybody watches The Pit. This is not a spoiler, but It's like the
I love it.
episode where it was a recent episode, and one of the doctors is just like has to keep charting, and like there's all
Yeah,
these
yeah, yeah.
emergencies happening, but she's not finishing her charting, and the main doctor's like, try this AI tool that I made, and I'm like, oh, when did she make this AI tool? But it was essentially a scribe. So I do think there is some obvious low hanging fruit, like the scribes, things that are going to help them kind of intake information with less mental overhead, to Brian's point, are kind of obvious things that are probably improving the situation for doctors and nurses and people on the front lines right now.
Well,
Sure.
an example you gave is like what they call alert fatigue, right? So all the alerts that going off, and ER is a good example because in emergency room you've got the noise, the alerts that are like bing, 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 bing. You've got the ones that pop up on their screens. You've got the ones that are pop up on every device they have. So that alert fatigue within high stressful environments like an ER is already a thing, right? So
Yeah, well, we had that problem in security too. Like I worked on cybersecurity, and managing alerts and looking at incidents and events and things were always a challenge. That was just trying to ingest and absorb all of those different indicators. And healthcare is no different. Like, I mean, there was an example that IBM used 10 years ago, 12 years ago, about how if you look at symptoms of a child, and this child hasn't been sleeping because they've been feeling so ill, and you eliminate bloodshot eyes from the diagnosis, you'll never be able to figure out what's wrong. When you add it, it becomes Kawasaki's disease. So it's one of those things of, not only is it alert fatigue, but it's indicator fatigue, right? It's how can you possibly factor all the different combinations of permutations of everything that could go on, environmental, symptomatic, biological, genetic, hereditary, and then be able to put all that together and say, yeah, this is what's wrong. Like, it's so AI can help and hurt in that. I want to ask a long form question here, which is going to open a whole can of worms, but we'll cap it at just a few minutes each, and then we'll do a couple of lightning round questions before we wrap it up. But here's my question: when I opened up the New York Times article in the beginning that I referenced, and I talked about the explosion of healthcare staffing, and it said across all of areas, right? It wasn't specific. Neither one of you said something that I thought you were going to say. So I'm going to bring it up, and I'm going to ask what you think, because I've talked to both of you about this independently, and I know it's something that you care a lot about. And that is, could the explosion of healthcare workers be attributed directly to AI as a result of mental health? So could we be seeing this explosion in need for social workers and psychologists and psychiatrists and general doctors for diagnosis of depression and addiction to devices and everything else because of these so-called, what are they called, decision vacations now, where people are letting AI run their life from the minute they wake up to the minute they go to bed, to the psychological dependencies that are being created with platforms like Replica and Character. And even just recently, right? Was it I don't want to get this wrong because it's a critical case, but a gentleman had taken his own life at the direction of an LLM, and I forget which of the frontier models it was. It might have been Gemini. I think it was actually Gemini. Now that I'm thinking about it, but I'm not 100% on that. It's not the only case. There have been many in the past 3 or 4 years. I actually published an article on that showed there were 12 to 15 cases of directly linked personal harm to frontier models between 2022 and 2025. What are your thoughts on that take on it? Could we be seeing this massive surge in AI use by human beings driving the need for healthcare, but not because we need more staffing for traditional medicine, but new areas driven because of AI dependency?
I'm not sure. I definitely think there are mental health implications, not only from AI, but also from a lot of the social media and things in the space, just like from a lot of being constantly plugged into everything. I know, like, I'm already somewhat ADHD. Like, I think technology kind of makes that worse in terms of being able to pay attention to anything for more than a few seconds. I'd love to see the breakdown in the article of like the
exactly.
particular industries that we're seeing the most hiring in. I think that we will see more implications on the mental health side from this technology, but I think it'll take longer for that to be maybe addressed by like a larger space. I think unfortunately we're seeing a lot of divestiture from mental health and other things that are critical for kind of the health of the country. It's something that's important to me. There's mental health issues in my larger family. I have anxiety, I have ADHD. And I also have some OCD, so I have a nice trifecta going there. But that's sort of my take. I'm curious your thoughts, Brian, but I wish we were investing
Yeah.
more in mental health. I don't know that it's happening.
Yeah. I mean, I kind of agree. I feel like, unfortunately, that's not the case. I'd like to see the data to see for sure. But the challenge was, and absolutely, the behavioral health or mental health needs, I'm sure, have increased substantially. Both post-COVID, started during COVID, and we certainly saw data that said, people were having lots of significant mental health issues coming out of it. The current, environment for lots of people is not helpful. AI and social media increasing that. But there's a difference between the needs that people have out there and our ability of our systems to actually meet it. Our behavioral health system and mental health system in this country has been broken even more than physical health for decades. If you look at who pays for behavioral health services, mental health services, we've got two systems of care, probably three systems, people with private insurance. And, if you have private insurance, you also have mental health insurance. But even though we're supposed to have, since the ACA, we're supposed to have mental health parity, we do not, right? Mental health parity from a policy perspective means that if I have private insurance, say Blue Cross Blue Shield, I'm supposed to have an equal amount of coverage for the behavioral health services as I do for physical, as part of my healthcare plan, right? It's not true. It doesn't exist.
Yeah.
If you have your private insurance, you have, like, they carve out and they contract with another provider and give you a limited network, because the network you have access to is more limited. You also have psychiatrists or people that don't take your insurance. And if they do take your insurance, you have a copay that's not equal to a copay for physical health services. So we do not have actual parity, even though it's required by law. Then we've got the system of people, say Medicaid or whatever public health services are being rationed for people with behavioral health services. You cannot get a bed in this country for days, if not weeks. If you live in a big geographic area, a big city like Philadelphia or New York or any large city, this is driven by substance abuse problems, right? We have a substance abuse crisis in this country, and the majority of those types of that inpatient, I'm talking about inpatient for behavioral health, because the majority of those beds are taken up by people with an addiction problem. Makes sense. They need to be in treatment first. It means there's not enough slots, actual physical places for people that are in crisis, that have a mental health condition that need to be inpatient for a period of time, right? This is a huge crisis right now in every major U.S. city where it's being rationed.
So,
Yeah,
do you think AI is going to help that? Like, do you think
No,
AI could alleviate some of that by
no.
having virtual doctoring and things like that?
It's helping to some extent in the sense that we already have, like, Better Health. We have these apps, we can access on your phone, but they're not trained psychiatrists. They're like a social worker, right? So it kind of begs the question, what type of services actually work, right?
well,
Behavioral health, we have cognitive behavioral counseling. We have, like, lots of modalities, right? There's not great evidence that suggests that one technique is better than the other. Our behavioral health, the research, everything behind how we provide behavioral health services is about 50 years behind in terms of real data, right?
yeah.
It's underfunded. Like, there's no current research
There's there's
except
two
for some
sides of it, I think.
meds.
Well, there's two sides of it, I think, and Brian, like if you've ever dealt with some like a family member, like particularly if it's like schizophrenia, bipolar, that's
Yeah.
in like an episode and a mental health crisis. I've had to deal with that like once before, and it's absolutely terrifying. And even places that are available are not particularly great that you would want
Right.
to maybe send them to.
Right.
So there's
Right.
that whole crisis is paired along with the substance abuse crisis, which is huge. AI is definitely not going to have much of an impact on anyone really in crisis. Well, in that sort of immediate
Right. Yeah.
acute crisis, I would say. I
Well,
don't
maybe not
know.
immediately, but let me ask a question then. I mean, we all know that AI probably has much more of an opportunity to help on the operational side of things, to deal with efficiencies and trying to make things easier from that perspective. And wouldn't that efficiency creation then, as long as there isn't a reduction in manpower, as long as there isn't a reduction in labor force in the healthcare industry, allow them to be able to shift to more valuable areas that are a little bit less focused on, like mental health? And I mean,
In
that's one
theory.
thing to think about. Another thing to think about too is that, isn't it ironic that the area that large language models are being used the most by the average consumer is in therapy type activities?
Well,
That's going to get noticed, and there's going to be innovations along those lines, I would think, on the mental health aspect, because it's just becoming too much of a use case for LLMs, and it's becoming too important of a healthcare problem.
well, the two
That's
things I
true.
would say is, yeah, indirectly, operationally, it will help there. What I was going to say, the second part, I guess, of what I was going to say is these acute sort of crisis situations, it's not really going to be a direct help. I do think potentially, like from a therapeutic angle, and like, LLMs are good at talking to people. I do think that they're probably helping people to some degree in this, like, with anxiety, depression. I mean, I don't have numbers on these things, but I do think we still have to be concerned about AI acting in that capacity, because especially for Gen Z, one of the biggest issues with Gen Z is still the loneliness epidemic of that
Mm,
in that
that's a good point.
generation. And I don't know that turning inward increasingly towards tech is necessarily the best way to treat that problem. The second leading cause of death for people ages, I don't know the exact, if it's 18 to 30 or something, is suicide.
Suicide. Yeah.
Um, yeah, I think we just have to tread carefully there. I think it probably is helping some
Yeah.
people, but I think we have to look at it in the bigger context of the forces at work. And
Exactly.
I don't know. I could talk about mental health forever, because there's so many problems and there's so much we could do better and should be
Yeah.
doing better.
Yeah. And it's
So
such a
let me ask you, just because I know we're coming close to the end here. I want to do a couple of lightning round questions for all three of you. Jason, I'm sucking you into this.
Oh boy.
So, quick point of view, future of healthcare and healthcare providers. I'm going to give you three different visuals or analogies to think about, and I want you to tell me what you think is closest to what's going to happen. You've got Star Trek, where you've got exceptionally well trained humans using incredibly advanced tools. You've got Elysium, where you've got incredibly advanced healing capabilities, but only available to the upper crust. Or you've got Idiocracy, where you've got no humans that are aware of anything at all except how to drink electrolyte fluids, and booths of medical situations that stick probes up you and all sorts of different things and then tell you to go home. So are we looking at Star Trek, Elysium, or Idiocracy as the future of healthcare? Christy, what do you think? Just quick answer.
I think we're somewhere between Elysium and Star Trek. Again, given the larger forces at work, I think Elysium's kind of a fitting metaphor. And that's my concern. I want to be Star Trek. I don't want to be Elysium, but I think we could go either direction, and that's what we need to be really aware of right now.
Cool. Brian?
Yeah, I mean, probably same answer. I've lived my life and worked in healthcare with the Star Trek ideal and goal as what I see is what I would like. That's my guiding star, like what I would love to see for healthcare. And I think, Matt, I've talked about in the past, I talked about the tricorder as an ultimate metaphor for where I think AI could be inserted within how we do human care and how, as one example, obviously the later series have more AI enablement than just a tricorder would have, including AI doctors. But unfortunately, I agree a lot with Christy. What we're seeing right now, the signals are pointing to this Elysium future. And unless we wake up as a society and realize that, we do need to take care of each other. It takes a village, and healthcare in particular. It takes all of us really working together in an ethical way to ensure that the future we want to see is happening now. And there's not enough of us working in that space. That I think we're committed to AI governance and governance first, but that's a hard sell right now. I think in 2026, it's picking up a little bit more. We have more conversation, but I can tell you last year, I did say AI governance, people would be like, hey, see ya. That's not where they want to spend the money. They want to spend the money to get ahead and be the first to have whatever the AI product is that's like, oh, that's the next thing to take off the market and get a $900 million valuation like
Sure.
NVIDIA or whatever. Until we slow down the hype cycle, until we put actual governance first and ensure that AI is aligned with human needs, I'm afraid it may be Elysium.
Fair. And Jason?
This is a fantastic question because it's so much bigger than just how are we going to administer health over the next little bit. I see it as almost a progression. I see it as all three. I think we're probably in the short term going to be trending towards idiocracy for a variety of different reasons. It's not just healthcare, but other premises that are popular in the movie. But I don't see us avoiding the Elysium scenario. As long as we are in a free market society where innovation is being driven by profit, I'm not sure that we can completely avoid the Elysium scenario. Now, I guess it depends on, the weights and measures and the levers of the democratic republic that we live in and deciding what's going to happen, at least as far as, the will of the people. And we might end up heading towards Star Trek. I think Star Trek is eventual, and I don't think there's any way we're going to get, we're not going to hit Star Trek. We're either going to hit Star Trek or we're going to hit frickin' Skynet. It's going to be one or the other, right? So in my hope, I really do. If I could get Dr. Beverly Crusher to help me out, I would be a very happy man, and not she's a great doctor, and forgive me for saying that, but as a Star Trek fan, you just have to bring that up, that she's one of the best actresses that have graced the stage of Star Trek. But
100%.
Talking about Gates McFadden. Gates, if you ever see this,
loved her.
Call me. We can talk, okay?
And can we talk about Picard season 3 with Gates McFadden?
Oh, yes, we can.
Stunning.
My goodness.
Stunning actress and amazing scripts. Anyway.
Yeah.
So the good news is there's a general consensus that none of us are getting rectally probed in the future by dumb machines and no trained humans in sight. That's a good thing. We're not an idiocracy. That's great to see. Great to hear it. All right. So lightning round. 3 quick questions. Just give me a thumbs up or a thumbs down if you agree or disagree, or if you like or don't like. Here it is. Ready? Question number 1, chocolate for health. Do we like it? Yes. Okay. Question number 2, a little edgier, THC. How do we feel about it? Mixed. All right. Everybody's kind of on the fence. I can totally get along with that. How about daylight savings time?
Come on, man.
Wow. Okay.
We're not all farmers anymore.
Split decision
We're
on
not.
that. And of course, I wanted to close on daylight savings time because it is Friday, March 6th, and daylight savings time begins in just 2 days from now, actually on International Women's Day. Speaking of Christie, speaking of Gates, thank you both. We appreciate you and everybody else out there. But this has been quite an interesting conversation. Not exactly, I think, what we were thinking about in the beginning, but as with everything, news happens, and it's better to talk about something that's current, right?
Indeed.
Totally.
Brian, Christie, thank you both so much for your time today.
Sure.
We really appreciate you being on with us here at AI Diatribe. And for those that are watching and listening, thank you for making it all the way to the end. We will have another episode for you just as soon as we can. In the meantime, take care, and we'll see you next time.
Thank you.
Thanks.